Hello, everybody. It's Phil Jacobus. It's September 23rd. I'm at my home in Woodstock, New York. Thank you very much for joining me. In a few moments, I'm going to share with you an interview that I did with Hillary Wright last week when I was in the office. Hillary is an author that wrote a book that I happen to have a copy of here, if you can read it. The pre-diabetes diet plan. I read this and lost 150 pounds over 3 years, thanks to Hillary. So she's a hero to me. But before we go to the interview with Hillary, let's take a look at a couple of stories that are happening in our news. We talked recently about how oncology treatments are falling behind and people aren't getting all the treatments they need. And here is a story where CMS has introduced a new payment model for radiation oncology. Astro and ACR are both seeking to delay the implementation of this. Read this story. Another very sad story in a sad, otherwise sad time is how, as a result of a cybersecurity attack in Germany, a patient died. So cybersecurity is a terrible problem, but this is even worse when someone dies. As always, I encourage you to sign up for our online news. It's free. Although our magazine is in depth, our news stories in the online news are hard hitting and cover all of today's topics. So please sign up. It's free. I know you'll enjoy it. And now it's Phil Jacobus again here in my office in New York with Healthcare Business News. And today I have the good fortune of being joined by Hillary Wright, who is a registered dietitian and nutritionist living outside of Boston. Hillary, thank you so much for joining us.
My pleasure, Phil. My pleasure.
You know, Hillary is more than just a casual person for me, because I went to the doctor at one point and the doctor said that I was pre-diabetic, and my bride, Barbara, bought a book for me called the Pre-Diabetes Diet Plan, which I have a copy of. And I read that book, and over time, I lost 150 pounds. And of course, I also exercised. And so really Hillary changed my life. And so I stayed in touch with her, and I bought a number of copies of her book. And some of you may have attended a lecture that I gave somewhere along the line, and I gave you a copy. And Hillary, tell us, you have a very complicated career because you work for a fertility clinic and a cancer center and a hospital. Just fill me in a little bit on that. Fill us in a little bit on that.
Yeah, I do have a unique career. So I'm partially employed by my benefits-bearing job, which is the Dana-Farber Cancer Institute. But then I do a lot of outside work for myself and for others. And it all really began because I started out as a clinical dietitian. So I worked in intensive care units for 6 years and learned a lot about the physiology of the human body. And, along that vein, came to a realization that I wanted to work to help people hopefully not become in need of that kind of care, because I thought the use of a registered dietitian to try to keep people healthy seems like a pretty good career path. And could be very gratifying. So I moved from that arena to a company called Harvard Community Health Plan, which then became Harvard Pilgrim Healthcare, which at that time, very interestingly, Charlie Baker, who's the governor of Massachusetts, was the CEO of that company, which we've been very lucky to have him have that healthcare background in managing, the current situation. And there I was a generalist, and I did a lot of diabetes education. But I was in a large group medical practice in downtown Boston, where I would get patients from the diabetes clinic. I would go to the oncology infusion area and counsel people getting chemotherapy. And I was asked to start participating in some treatment for the people in the fertility clinic. So I was definitely a generalist, but was developing some areas of expertise. And so when I went to that job, I started working part-time because I wanted to be home with my 3 kids. And so I just kept adding jobs, and that included writing books.
So tell me about your first book.
So my first book is called The PCOS Diet Plan. So more people are aware of this condition than they used to be, but that PCOS stands for polycystic ovary syndrome, which is the primary cause of anovulatory infertility in women of reproductive age. But it also carries a lifetime increased risk of diabetes, heart disease, and endometrial cancer. So because these women often present for fertility clinic, to the fertility clinic, they would get this diagnosis and then they would send them on to me. But we've known about this condition in one form or another for over 100 years, but it's only been since the 1990s that research unearthed that really the common thread behind this condition is insulin resistance. So when I started seeing these patients, I thought, I don't know anything about that condition. I'll learn. I read and I spoke to people, but I do know a lot about insulin resistance. I come from a family, I'm one of 6 children. 2 of my brothers have type 1 diabetes and are now in their, one's about to turn 50, one is in his early 50s, and they're both in excellent health, despite having that condition from a young age, largely, I think, because my parents learned what they needed to do and were able to help them learn how to care for themselves. But there's a lot of type 2 diabetes in my family too. And so I thought diabetes prevention is definitely worth it because it's just exploding in our population.
And
So I thought I know a lot about insulin resistance.
Does diabetes plays a role in PCOS? And so you wrote a book that helped people through diet to improve their condition. Is that correct?
Correct.
Shortly. And then you wrote your second book, which was the pre-diabetes diet plan, the one I read.
Correct.
And that you built off the knowledge that you already had.
Yeah, I mean, I had developed a skill at taking endocrinology and making it understandable for average people, which there was a need for that. So I thought, why not me? I've been doing this with real people. Let's put it in print.
Now, what about your current book, which is so you have a lot of knowledge about women's health. You have a lot of knowledge about diabetes, and apparently you have some knowledge about men's health as well, because I benefit from the book. So that has brought you to your latest book. Please hold it up for us.
Yes, this is hot off the press. Came out a little less than a week ago. The Menopause Diet Plan.
I see. So that's excellent. Tell me about that.
So, women as they get older and hit the perimenopause, menopause time of life do start to develop an increased risk of chronic health problems, including diabetes and heart disease, increased risks of some cancers. What really drives a lot of women insane is the what seems to be early or easy weight gain through these years. So that was really interesting to look at what is the science related to menopause and weight gain versus just midlife and weight gain. But again, people are often confused about nutrition, and I just feel like, and I wrote this with my my co-author and my good friend, Elizabeth Ward. She is also a registered dietitian. We met as undergrads in college and always wanted to collaborate. So she's also a really talented recipe developer. So we came up with this book that's a combination of let's teach you about your body to stay healthy, age successfully, lower your risk of many chronic illnesses. And by the way, here are some really easy tools and visuals to follow to help it feel like it's doable. So
let's say that I'm married to a woman who's post-menopause. Is that the correct terminology? I'm embarrassed to say that I don't know. Would I enjoy the things that, as a guy, would I enjoy the same diet that is good for my wife?
Absolutely, absolutely. Because it's based on the same balanced plate approach that I have in my pre-diabetes book. It's
right.
The same sort of, these infographics are interesting pictures designed to take complicated science and make them understandable to the average person. So that same approach is actually presented in this book. And the meal plans that we have and the recipes that we provide and the examples of snacks with protein, it's all, basically this very similar to what's in the pre-diabetes book. It's just that Liz was able to, I added a few recipes, but I would absolutely defer to her. She brought most of the recipes to the table, and they're very easy to make and crowd pleasers because we've fed people with these recipes and we know that people like them.
Well, that's great. I have to get a copy. So for my wife and for myself.
Oh, I will absolutely send you one.
And in the book, in your book that I read, there was a section in the book about counting calories and a section in the book about like the balanced plate.
Mm-hmm.
And of course, I'm no rocket scientist, but I found the balanced plate to be easier for me to grasp than the calorie counting or the weighing and all this stuff. So that was what I followed. And when I give the book out, I always recommend to people that you focus on the balanced plate.
And I always tell people that the plate should do it for you. The calorie information and the kind of calorie controlled meal plans are there for people that want more detail, but I'm with you. I don't believe most people need that. Some people are numbers people and they just want to know what does a certain amount of calories look like. But 100%, you can take that balanced plate to a restaurant, to a sandwich shop, to your kitchen, and very easily apply it as a template.
Right. So is there one little piece of the new book, the post-menopause diet plan? Did I get it right?
The menopause diet plan. I also want to point out that it's basically a healthy aging book because menopause is like a day you hit, 12 months without a menstrual period. This is about from the time that transition hits into the rest of your life.
I see. So is there one little gem that you want to share with our audience?
Yes.
Maybe a gem and a recipe, please.
Okay. So I want people to understand that healthy eating is much more about what you are eating than what you're avoiding. So my books, this one included, encourage people to just start adding healthy food to your diet and see what happens. Because often we think of we're talking about diet from the foods you're eating standpoint, not a weight loss approach. So that obviously is what happens when a lot of people follow this. So if you just start saying, if I don't eat fruit every day, I'm going to start eating 1 a day and then work up to 2 a day. And then I've hit the low bar for the recommendation for fruit. If I don't eat vegetables every day, I'm going to add 1 and then I'm going to add 2 and then I'm going to add 3. Like look at it like a flight of stairs. If you make enough of those positive changes, some of the less desirable stuff will start to get kicked to the side. And that's a different mindset, in my opinion, than what a lot of people think healthy eating is. It's about taking away everything you love. And like in the prediabetes book, we advocate for that 80-20 approach, to healthy eating. I don't really care what people do 20% of the time. I'm interested in 80%, that your habits, your routines, you can occasionally eat anything you want. So it's not about making food the enemy and total deprivation. It's to get people thinking about their default habits and could they use a little refining.
Well, as I said before, Hillary, I you changed my life for the better, so I appreciate it, and I have incorporated into my daily routine what you taught in the book, and I'm so glad. And I hope that people watch this and want to buy your book. If they want to buy your book, how do they do that? And I got to tell you that I don't allow any plugs on our sessions. You're the only person that I've ever done this with. So how do they go about buying your book?
So any online seller sells all of my books, and I have links to all of those at my website, which is just my name, HillaryWright.com with 2 L's. They're very easy to find.
That's convenient.
Yes.
All right. Well, you're a wonderful person, and it's been a pleasure for me to know you, and thank you for joining us today.
The pleasure is entirely mutual. It's amazing for me to see the results that you've had.